care is for patients who are ill. Any of us, when we get ill, we didn't choose to be in that place. We just, most sensible people want to stay well. So if we do get ill, we want the best possible care. Given that we can't always affect what illness does, that's have a life of its own, as it were, in the hands of the Almighty, in a way, we can affect how we look after patients, the experience that they actually have of the care itself. And so I believe, as many others do, that since that is under human control, nurses, doctors, managers, all the caregivers, we're responsible for the quality of that experience, and it behoves us to get that as right as possible. If I'm a patient, I don't want to have to worry about whether the care is up to scratch, as well as having all the natural worries that go with the illness in the first place. And I don't expect that my relatives should have to have those worries either on my behalf. My father was a family doctor in a mining community in the north of England. A very close community in which everybody knew each other. As a student, and latterly as a medical student, and then as his partner, I learnt at first hand just how important his patients judged him by the service that he gave. And he was driven by a service ethic. He saw himself as there to serve that community and the individual people who came to him. The patient is at the center of the whole transaction. Medicine is operated not for the benefit of doctors and medical science, but for patients who should be the beneficiaries. I bring you back to my starting point with my father. It's all about service.